When we were separating out all of the different requirements to go from the product idea to the actual MVP, one of the critical components of getting it done was ownership. My co-founder, Lane, who was a phenomenal chief marketing officer, she became an ops genius, right? She figured out how to find a 3PL, what were the requirements of our physical product, how would it be sent to customers. My other co-founder, who was our chief science officer, she took over thinking about how are we going to explain 700 different bacteria and fungi to patients and to doctors. And because we were able to kind of separate out the ownership, we didn't have to brief each other in on every single finding, whether it was from the market or the experts or the patients. We were able to kind of work on the pieces that we owned. And then as we were putting it together, kind of translate those learnings and insights into the rest of the experience. Evvy raised a $5 million seed round in July of 2021. I think a huge part of what made us successful in the fundraising process was the amount of information that we had about all of the categories that we've discussed today. We deeply understood the market and how underserved it was and how much need there was from patients who were actually spending a lot of their own money buying Band-Aid solutions at CVS because the healthcare system was failing them. We deeply understood the science, the expert point of view, and we really, really understood the patients. And I think that really came through when we were fundraising, where we weren't really surprised by anything anyone had to ask because we had become truly the experts on the space we were operating in, as well as the solution that we were building. Additionally, I think the data from our prototype beta program was incredibly helpful. We had 50 real women who went through the experience. We had their ratings on every single part of it. We had their reviews. We had, the utility of how this information helped them in the healthcare system. And the other tactic that we used was we had actually just launched the product the week before we fundraised. And because of that, we actually sold out of our initial batch of product that we had made. And I think that was incredibly helpful in terms of market validation when we actually went to go fundraise. Equally as important as what you choose to build is what you choose not to build. And for Evvy, and I think probably for anyone who's starting a company, the list of things that you choose not to do is always much, much, much longer than the list of things that you choose to do. And at the end of the day, the things that you choose to do have to come back to those key pillars that we've discussed. They have to be the things that give you clinical validity, that help you, base things on the science, that are actually where the market's headed, that are really what the users need. And I think when you operate within the constraints of time and money, which is often the constraints that we're operating in as a startup, you can't really afford to focus on anything that is not mission critical for those buckets. Making a constant list of things that you're actively deprioritizing is incredibly important. In our requirements document, in which we listed each piece of what we needed to do in order to get the product live, we had a backlog of all of the ideas and things that came up that we knew we wanted to do. And I think it was mentally helpful to feel like we were jotting it down somewhere, but also knowing that it wasn't a priority to get into that MVP. At Evvy, we're iterating on our product every single day. And the way we choose to make the decisions of what we prioritize and what we change always come back to those same pillars of research. As we launch new innovations, as we expand into new channels, as we work with new customer types, we never forget the key pillars of market research that helped us get to where we are.